So who should do cervical cancer screening? Anyone who is above 25 years of age, anyone who is sexually active and more than 25 years of age. The recommendation is that you do cervical cancer screening. The reason why is obvious. HPV is sexually transmitted and it's very common, and therefore there is a very high chance that you may have it or you may get it once you're sexually active. And then 25 years, because most of the HPV that is acquired before 25, for example, between 15 to 25 years of age, your own body has a way of clearing it, and therefore we don't really bother with it as much. So we start paying keen attention from the age of 21. Different countries have different guidelines, and there are people who start the screening from as early as 21 years, but us locally we do from 25 years of age. And we do, depending on the kind of screening you have done, there are those ones that you have to screen every 3 years, and that includes the pap smear. So if you're doing pap smear alone, the recommendation is that you repeat it every 3 years. I know that those people who prefer to do it every year whenever they do their annual checkup. There is no harm in doing it, but really it's not necessary. So the recommendation is to do it every 3 years. If you are doing a pap smear together with the DNA, the HPV DNA detection test, then the recommendation is to do it every 5 years. If you're doing the VIA and the VILI test, again, the recommendation is to do it every 5 years. So you will repeat this routine screening until the age of 65, okay? Or if you have had surgery to remove your uterus, what we call hysterectomy, you stop it at the time that your uterus is out. But be very careful. Sometimes you may have had surgery to remove your uterus, and they removed the uterus, but they left the cervix intact, okay? Because we know that HPV affects the cervix, it means that you have to continue carrying on with the screening tests. And that means even if you had the hysterectomy but your cervix was left behind, you continue with the routine screening for cervical cancer, because it can still come and affect your cervix. But if your uterus was removed together with the cervix, you don't have to do it anymore. Again, another disclaimer: if the reason for the surgery to remove your uterus was because of cancer of the cervix or because of some abnormal cells of the cervix, it means that you will still need to carry on with the screening until the age of 65. But if the reason for the operation was because of something innocent, such as a fibroid, or just abnormal bleeding, and there was no cancer at all that was detected, you can stop at that particular time when the surgery is done to remove your uterus, be it when you're 40, be it when you're 39. If they have removed the cervix and the uterus and the reason was benign or innocent, you can stop it at that particular time. Okay, another point to note is that if you are HIV positive, HIV virus itself together with the HPV virus, they sort of accelerate the process of developing cervical cancer. And therefore, if you are HIV positive, the recommendation is that you do the screening every year instead of every 3 years or every 5 years. So HIV positive, you know your status, regardless of what your viral load is, regardless of whether you're on ARVs or not, please do your screening for cervical cancer every year instead of the usual recommendation. All right?